Hey everyone, it's Harlan Kilstein here, and thanks for joining us this evening. We have another fascinating, informative program for you about taking care of your family member, your fur baby. Tonight's especially important. I'm listening with eager ears because I just went through something with my Pomeranian Kalba that I'll share with you in just a moment. Of course, our Merrick Pet Care is sponsoring Dogington University. They are the leader in the real pet food revolution, food worthy of a fork. And I've got to put that picture up I have of Kalba next to a stack of Merrick cans. She loves their food. Um, they make a wide variety of dry and wet dog and cat food. You can get it at your Petco store or other pet independent specialty stores. The food in Merrick, it's real food. It's all made in the USA. The ingredients are listed right on the label. It's made with USDA inspected deboned meat as the first ingredient, and it's got real produce. You see the package there on the screen where you see real meat, real food. That's what's inside. Now, in the course of the program today, we're going to give one lucky participant a bag for a free voucher of 25 pounds of the new grain-free real Texas beef dry dog food. And then, in addition to that, Merrick's going to donate an additional bag in the winner's honor to National Mill Dog Rescue. So we'll be asking you a question based on the content from our presenter today, and then we will take it and ask you the question, and the winner will get um, that product mailed. We'll get a certificate for that product mailed to them. I just want to warn you that we have some really sharp, fast typers out there. So you better be fast to answer the question. A lot of people have tried typing in the answers before I even ask the questions. Good luck to you with that. I don't have any problem with it. And make sure that you answer the full question or you'll miss out. But generally, you've got about a second or two to answer from the time I ask the question, and there'll be plenty of warning on the question. Uh, Now, just about a week or two ago, I had to rush my Pomeranian Kalba to emergency care because she was spending a lot of time throwing up. She was limping and she could no longer jump up on the couch, and racing up and down the couch is her favorite thing. And when I saw the bill, I said, oh my God, should I have had better insurance for her? And it was nearly $1,000, the bill, for an X-ray and blood tests and so forth. Fortunately, she was okay and just needed some rest and ate some very, very simple food for a day. Um, but she was okay. But $1,000, wow! And I know people spend a lot more. Our guest today, Dr. Doug Kenney, is going to have something to say about that. He's been a practicing veterinarian since he graduated from Auburn School of Veterinary Medicine in 1977. He's got a special interest in wellness care and teaches pet parents to save money on their pets' health care by taking steps to prevent many of the problems vets see every day. Dr. Kenney writes the Healthy Assurance blog for PetMD.com. He's also an expert on pet health insurance. He's authored blogs and hosted podcasts in this field. He's going to answer questions about the importance of insurance, choosing the right company and policy for your fur baby. So I'm going to go ahead and I'm going to make him the presenter, and I think we're going to hear something that's important to everyone.
Okay, thanks, Harlan, and thanks to Merrick Pet Care for sponsoring this series of webinars. And thanks to the Dogington Post community for the opportunity to share this information with you about pet insurance.
Okay, just press the slideshow down on the bottom left of your, there you go.
Okay.
And just hit your space bar to advance your screen.
Okay, thank you. In this webinar, we're going to be focusing on two questions. There you go. Thank you. We're going to focus on two questions that I see asked over and over on pet forums. The first question is, should I purchase pet insurance? Or should pet insurance be part of your financial plan to pay for your pet's health care? The second question is, which pet insurance company should I buy a policy from? There are steps that you can take when doing your research that will improve the odds of selecting a company and policy that you'll be happy with. The reason you want to make a wise choice the first time is because if you end up being unhappy with your choice and switch companies, any conditions your pet may have developed while being insured with the first company will likely be considered pre-existing and not covered with the new company. So it's just better to get it right the first time. And I'll go over some tips and strategies that you can use to do your research and find the right company and policy to insure your pet. But first, I'd like to go over a little background as to how I ended up blogging about pet insurance. For years, there was only one pet insurance company, VPI, and we kept some of their brochures on hand to give to clients who asked us about pet insurance. Then I kept getting brochures from other companies that I didn't even know existed. And what made an impression on me was how different each company's policies were. So I started doing some research and discovered that there were actually 8 companies that were selling pet insurance policies in the United States. And I found out what probably many of you have found out, and that is reading a brochure or visiting a company's website just led to more questions. And it occurred to me that surely other people may also have the same questions I did, so I decided to put the information that I had learned in a paperback book. I eventually published an ebook version because it seemed that a couple of companies each year would change their policies and it was just easier to update. I also started a blog as a platform to continue writing about pet insurance. And then a little over a year ago, I started the podcast, and as far as I know, it's the only podcast devoted just to pet insurance. And I've interviewed representatives of all the pet insurance companies in the United States except 2, and I'm working on getting those interviews lined up right now. I've also interviewed a couple of readers of the blog who shared the process they went through when researching and choosing a company to insure their pet. And interestingly, both of these pets were older pets. I always ask the people I interview to tell their story about why they decided to get involved in the pet insurance industry. The individuals who start these companies are entrepreneurs with fascinating stories, but the common theme is that they all have a real heart for pets and a desire to help pet owners be able to afford the health care that they need and want for their pets. I recently attended the North American Pet Health Insurance Association's annual meeting and finally got to meet some of the people that I had interviewed, and I can tell you that they are truly dedicated to making pet insurance better for veterinarians, pet owners, and their pets. So with that, let's get started answering this question: why purchase pet insurance? I think there are some misconceptions about what pet insurance is and the role it can play in helping pet owners afford to pay for their pets' healthcare expenses. People purchase pet insurance to help them pay for large, unexpected veterinary bills that they would have trouble paying for out of pocket. And look at the two highlighted words. You purchase pet insurance primarily to cover those unexpected accidents and illnesses that your pet might experience that are oftentimes also expensive, as Harlan found out a couple of weeks ago. This is important to understand in light of the debate we're going to talk about in just a moment, but I want to go over this statement here. A pet insurance policy transfers the risk of significant financial loss from the pet owner to the pet insurance company. Now, the debate we're going to talk about is pet insurance versus a savings account. There are some who recommend, instead of purchasing pet insurance, you put money in a savings account that you would be sending the pet insurance company every month to self-insure your pet's healthcare expenses. Then if your pet gets sick, you can pay for it from your savings. Dr. Carol McConnell, VPI's Chief Veterinary Medical Officer, and I had this discussion in a podcast episode.
I'm glad you brought that up about self-insuring, because a really frequent bit of advice that I see given by veterinarians, other pet owners on pet forums is rather than spend money on pet insurance premiums, just put money in a savings account and use that fund to pay for all your pet's healthcare expenses. And I think that's just a fundamental misunderstanding of what pet insurance is for, because I think a savings account is a good idea too, but they're just two different ways to help pet owners actually be able to fund their pets' healthcare expenses.
You could make that same argument with any insurance category, in fact. If we just save the money on the side, you wouldn't need, the insurance. And it's difficult because as a culture in America, for us to see that difference. We insure our cars mostly because our State Department of Motor Vehicles requires us to insure our cars, right?
Right.
We insure our homes because usually our mortgage company requires us to insure the house because they've got their money in it, right? When you get to optional insurances, whether you rent an apartment and you need a tenant's insurance policy, or if you get flood insurance on your home, which again is completely optional, and then the rural pet insurance, again, completely optional. For some reason, we as a culture superimpose this assumption that the money you put in has to be equivalent to the money you get out. And they look at it as an investment. But that's not what insurance is. It shouldn't be a money in, money out thing. It should be you're building a plan to financially cover a random event that could be very expensive that you don't see coming. So now let's get to the insurance perspective versus savings, right? So this idea of, well, people should just create a savings account. Is that a viable financial plan for a random event that's really expensive that you don't see coming? Well, here's the flaw in that logic. Number one, you don't know when that random event is going to occur. If that a random event occurs in month number 2 of your plan to save the money, guess what? You're in trouble because you've only saved at maybe $50 a month, 2 months, $100. But if you had the insurance at $50 a month, you still have full coverage in month number 2. So insurance versus savings account, big issue in the timing difference. And then the second one is the American's ability to save.
Yeah.
I don't think, I need to explain, right? The average American's ability to set aside money, earmark it exclusively for pet expenses or veterinary expenses and not touch that money when, say, the washer breaks and they need a new washer, of course they're going to go raid the pet savings account. So there's 2 major flaws in it right there. So that's usually how I try to explain to veterinarians, and I hear them just like you, Doug, saying, well, clients or pet owners should just open a savings account. It's just not that simple.
Now, I think, again, having a savings account is a great idea, but not instead of pet insurance. I think it's a matter of, I don't think it's a matter one or the other, but I think both. They complement each other. If your pet should experience an unexpected medical problem that you aren't able to pay for out of pocket, the insurance can help protect you from having to make the difficult choice of economic euthanasia. Pet insurance in the United States was started in 1982 by a group of veterinarians in California led by Dr. Jack Stevens, who is currently the founder and president of Pet's Best Pet Insurance Company. Dr. Stevens has always said that his primary motivation for being the pioneer for pet insurance in this country was to end economic euthanasia. Here's a link to a story of a career-altering encounter with a little girl and her mother in a grocery store of all places that led him on a lifelong quest to provide pet owners with a way to always be able to afford their pets' health care. I recently interviewed Dr. Carrie Marshall, a veterinarian on Trupanion staff, who had these comments.
The problem that I really thought needed solving, kind of the elephant in the room for veterinary medicine, is why do we still have the option to put a pet to sleep because the client can't afford it? How do we get that to go away? Compassionate euthanasia is very much needed, but economic euthanasia needs to go away. And then why, when you walk into a shelter, are half the pets there because the people couldn't afford their care and relinquish them? Those type of things we have to solve those problems, and also save the guilt from the client of having to put their pet to sleep or give their pet away because they couldn't afford the care. They may not get another pet after that. So we could be really impacting pet ownership overall if we do this right.
I think Dr. Barry Kipperman is a board-certified internist who founded Vet Care, a 24-hour emergency and specialty hospital in the Bay Area of California. Listen as he talks about this issue. I think what you're saying is that a pet who loses his or her life due to economic euthanasia, that is, because their owner is unable or unwilling to pay for the care that would be needed to save their pet's life, ought to be as unsettling to veterinarians as a pet who dies of memory cancer, both of which are potentially preventable.
I couldn't agree with you more. I think that if we define this problem, economic euthanasia, meaning an animal's life ended principally as a result of financial ramifications and financial preparation or lack thereof, if that were an infectious disease, there would be a clamor within our profession to work on a vaccine, and a task force would be assigned. But because no one has given this problem a name, I think the profession has just kind of shrugged its shoulders and taken for granted that this is the way it's going to be.
I assume you are an advocate of pet insurance.
I am a strong advocate of pet health insurance because the reality is that what our profession has learned from the recession is that asking your clients to put $50 a month under their mattress in a fluffy savings account is not a realistic expectation.
Dr. Kipperman also says that he hears pet owners say way too often, "I never imagined it would cost this much to save my pet's life." He says that many pet owners are simply unprepared for the potential cost if their pet is ever seriously ill or injured, especially if it involves a visit to an emergency clinic or a specialty hospital, where the costs are generally higher than at their regular veterinarian's office. So let's take a look at some potential cost. Anterior cruciate surgery, a congenital liver shunt, and yes, some pet insurance companies do cover congenital problems, chocolate toxicity, pancreatitis, luxating patella or kneecap in a dog, bloat, hit by car, heat stroke, cat that swallowed a strange foreign body, liver toxicity. This was a dog that they thought may have eaten some mushrooms, mast cell tumor, inflammatory bowel disease, a broken leg in a kitty cat, hip dysplasia, and this was a total hip replacement, intervertebral disc disease, feline lower urinary tract disease, and lily toxicity in a cat, a routine surgery that developed complications. This dog went in for a spay and developed several complications afterwards, and the bill wound up being about $18,000. Cataracts, and this one, a foreign body ingestion that surgery was done and developed complications, and the bill came to $46,000. And a pet insurance company recently paid almost 90% of this claim. Now, granted, most of the examples, these actual claim amounts, when you file a claim, most of your claims are going to be less than these amounts. But the reason you should purchase insurance is for these types of scenarios. So the question you should be asking yourself is, if your pet had one of the problems on this list and you face that bill, would you be able to pay for it out of pocket? If not, and you are among the 70% of pet owners who say they would spend any amount to save their pet's life, then you should consider purchasing pet insurance. This quote is a good summary statement about this issue. And when I saw this quote, this is actually a Tom Collins came to this conclusion after he did some research involving pet insurance versus a savings account. He's a contributor to Blog Pause. And when I read this, I thought, this guy gets it. He understands what pet insurance is and the role it can play in paying for a pet's healthcare expenses. There is another factor that I believe has been a hindrance to more pet owners being able to benefit from pet insurance. As many of you know, traditionally, pet insurance has operated according to the reimbursement model, where you pay your veterinarian in full, then file a claim, and the pet insurance company reimburses you minus the deductible, copay, and any non-covered expenses. And it generally takes about 2 to 3 weeks turnaround time between filing the claim and receiving your reimbursement check. But what about those pet owners who would like to do whatever it takes to save their pet's life in the case of a serious accident or illness, but can't afford to pay the veterinarian the whole amount up front? Most, but not all, of the pet insurance companies will pay the veterinary hospital directly if the veterinarian agrees to this arrangement. The pet owner would then pay their veterinarian the difference. I think there will be some resistance from the veterinary community to a direct pay model because they see this as a first step down the road of managed care like in human health care. They prefer the claim and reimbursement processes to remain strictly between the insurance company and the pet owner. Personally, I believe that it's possible to achieve a direct pay model without adopting the other tenets of managed care that plague the human healthcare system. Now, there are several things that would need to happen to make a direct pay model more acceptable to veterinarians. A way to quickly determine if a condition is covered or not. One thing that I do recommend you do as soon as you sign up for a pet insurance policy is request a medical record review. This is where you submit your pet's previous medical records to the insurance company. Most companies only require the last year or two, and they will let you know if there are any conditions that are considered pre-existing and not covered. If a review has already been done, it should be much easier and faster to determine if something is covered or not. A way to quickly get pre-certification of a recommended treatment. Here, the veterinary hospital would send an estimate to the insurance company, and the insurance company would send back how much of the estimate would be paid by the company. And this gives the veterinary hospital assurance that the claim will be paid and lets them know how much the client is responsible for when the pet is discharged from the hospital. Here again, having a medical record review already out of the way should aid in this process. And there needs to be a way to quickly reimburse the veterinary hospital. Most veterinary hospitals don't have the cash flow to bill an insurance company and then wait several weeks for reimbursement, especially on a large claim. And then all this needs to be done with minimal paperwork and staff time devoted to dealing with insurance claims. Ideally, if this can be done electronically, these processes could be carried out quickly with minimal paperwork and hospital staff time involvement. Many of the pet insurance companies now have direct deposit, which can significantly decrease the turnaround for reimbursement to even just a few days, and sometimes even the same day the claim is filed. So where are we? Trupanion is the first company to boldly declare the reimbursement model dead. Just this year, they introduced a program called Trupanion Express, and I won't go into the details of it in this webinar, but the last two podcast episodes have dealt with this. In podcast episode 17, I interviewed the CEO and COO of Trupanion as they talked about their vision for Trupanion Express and the direct pay model. And then in episode 18, I interviewed Dr. Carrie Marshall, who you heard the audio clip from earlier, because she was the point person on the development of Trupanion Express, and she explains more of the details of how it works. I've also been told that several other pet insurance companies are working with veterinary practice management vendors to enable electronic filing of claims and processing of reimbursements. So the ability to reimburse your veterinarian directly is possible right now with most companies. You need to ask whether the company will do this or not. Then the next question is, will your veterinarian agree to accept payment from the insurance company in the case of a very large claim where you couldn't manage the full amount of the bill up front? So now let's take a look at some tips and strategies you can use when searching for a company to insure your pet. You should always pay attention to what kind of maximum payouts a policy has. Some policies have a lifetime maximum, and this is the amount the company will pay out over the lifetime of the pet. These are usually high enough not to become a factor. Some policies have an annual maximum, which is the amount the company will pay out during the policy year. Then there's the per incident maximum, which is the amount the company will pay out for each diagnosis or problem your pet is treated for. This will limit your reimbursement if you file a large claim. Let's look at an example here. Both policies have the same annual maximum, but Company A's policy also has a per incident maximum. The invoice or claim amount is $7,800. The deductible and copay are the same for both policies, but notice the difference in the amount you would end up paying out of pocket. Now, most claims you'll file again will be less than the per incident maximum, but the reason you buy pet insurance is to pay for those times that you may have to file a large claim. Always consider your potential out-of-pocket cost whenever you have to file a large claim when you're deciding which policy to buy. One company, 24 Pet Watch, has policies with lifetime limits, but also category limits, which is kind of unique. The categories are actually body systems like nervous system, skin, respiratory system, and so forth. And then a couple of companies have no limits, that is, no lifetime, annual, or per incident limits. There's no maximum payout after the pet owner pays for the deductible, copay, and any non-covered expenses. And this is something that gets brought up a lot, and there's a lot of questions about coverage for hereditary and chronic conditions. And, you know, years ago, a lot of the companies did not cover hereditary and chronic conditions, but from my perspective as a veterinarian, coverage for hereditary and chronic conditions is essential simply because veterinarians diagnose and treat these each and every day. Some companies provide full coverage of hereditary conditions all the way up to their policy maximums, while others either don't cover hereditary conditions or provide limited coverage. For these companies, it's important to find out if they have a list of these conditions that either aren't covered or have limited coverage. You might be shocked at just how long the list is. And these are some chronic conditions and the accumulated claim amounts that I found on PetPlan's website. The first three diseases on the list are considered hereditary and congenital. Some hereditary conditions, though, can be chronic. The chronic condition is one that can be treated and managed, allowing the pet to maintain a good quality of life, sometimes for years. If your pet lives long enough, he or she will develop one or more chronic conditions, like heart failure, kidney failure, hypothyroidism, hyperthyroidism, or osteoarthritis. But don't get lulled into thinking that chronic diseases only occur in middle-aged and older pets. The last two examples on this list, cancer and food allergies, are diagnosed all the time in young pets. The food allergy example in this list was diagnosed in a 2-year-old dog, and the pet owner has spent over $13,000 in the first 3 years of management. This is why you should buy pet insurance early, because as you can see, if a dog or a cat's food allergy has to be managed for 10 plus years, it can be very expensive. In fact, PetPlan indicated that between 30 and 40% of all claims they receive are for chronic conditions. So for those companies that provide full coverage of hereditary and chronic conditions, there is no issue. However, for those companies that provide limited coverage, you need to determine what their limits of coverage are and then ask yourself, is it adequate in light of the amounts the pet owners have paid so far in these examples on the slide? How a company determines your reimbursement is information you need to know when you select a company to insure your pet. VPI uses a benefit schedule that lists hundreds of diagnoses and the maximum amount that will be reimbursed per policy year for each of those diagnoses. Several companies reimburse according to what is considered usual and customary for your veterinarian's zip code. If some of these fees on your invoice are more than this amount, you will pay the difference. They usually determine what is usual and customary using a combination of national fee surveys as well as their own internal data. All the other companies pay according to whatever your vet charges, minus the deductible, copay, and any non-covered charges. In my opinion, this is the most predictable and preferable. Most of these companies are the newer companies, so it's going to be interesting to see if they can hold down premium increases and remain competitive over the long haul using this method of calculating reimbursements. And this is one of the most frequent questions that pet owners have, is whether pre-existing conditions are covered by pet insurance. The short answer is no, and this is a frequent reason that claims are denied. A pre-existing condition is any problem that is noticed or diagnosed before you purchase pet insurance or during the waiting period before the policy becomes effective. Most policies have like a 15-day or 30-day waiting period. But there are some steps you can take that will hopefully prevent that happening to you. The key is buying a policy early on before your pet manifests any symptoms of illness or injury. Soon after getting a new puppy or kitten, you'll want to visit your veterinarian for a wellness exam. If the examination is normal and the puppy remains healthy until the waiting period is up for the policy to be effective, there shouldn't be an issue concerning pre-existing conditions. An exception to this is if your pet is later diagnosed with a congenital condition that wasn't apparent on the initial physical exam, such as a liver shunt. Some companies don't cover congenital conditions because obviously they're pre-existing. The puppy or kitten was born with it. Some congenital conditions can be diagnosed during a physical exam, but others may not be obvious until symptoms develop months or even years later. There are companies that cover not only hereditary conditions, but also congenital conditions, as long as the pet hasn't shown any symptoms prior to the policy becoming effective. So if you want to cover that base too, buy a policy that covers congenital problems too. If you adopt an older pet, when you apply for insurance, ask the company what they require to determine if there's any pre-existing conditions. In this situation, you may or may not have any previous medical records. Minimally, I would have an examination done and just to check for any obvious problems. If you apply for insurance and you've had your pet a while, always ask for a medical record review, even if you think your pet has been healthy. And here's why. Do you know everything written in your pet's medical record? You probably remember the big things that you had treated, but maybe have forgotten about the seemingly minor things or even a casual comment you made to your vet about your pet that made its way into the record. If the pet insurance company ever requests a copy of your pet's medical records, all those things will come to light and might be interpreted by the insurance company as evidence that the symptoms of a current problem were actually manifested before you bought the insurance and therefore considered pre-existing. So it's just a good idea to get a medical record review out of the way on the front end. One subcategory of pre-existing conditions is what most insurance companies call bilateral conditions. These are problems that occur on one side of the body that are also prone to happen on the opposite side of the body. For example, if your dog had a ruptured cruciate ligament in the left leg prior to your purchasing insurance, and then 2 years later the cruciate ligament in the right leg ruptures and needed surgery, it may not be covered. Many of the pet insurance companies will allow you to custom design your own policy by selecting from among several maximums, deductibles, copays, and even some optional coverages. Therefore, by manipulating these variables, it's possible to get a policy you want at a premium that fits your budget. And here are some priorities that I suggest to consider when customizing your policy. First of all, get the highest annual maximum you can afford. You buy pet insurance to cover that worst case scenario. It does you no good to have an insurance policy that provides inadequate coverage should that scenario ever happen. Unless you have a 0% copay, you always pay a copay with every claim. So get the lowest copay you can afford. Even if you've met your annual deductible for the year, you'll still pay a copay. And while the deductible is a fixed known amount, the copay is a percentage of the total bill and therefore varies with the size of the claim. If you get a quote and it's higher than you're comfortable paying, I recommend making adjustments in the reverse order of their importance to try to get a premium that you can afford. In other words, I would change the deductible first, try getting a higher deductible, and if that did not get you where you needed to be, then you can select a higher copay. But as a last resort, and again, this is because you want that worst case scenario covered, you can choose a lower maximum. But when you, one caution I want to make is if you choose a higher deductible, keep in mind whether it's a per incident deductible or an annual deductible, as this might make a difference in how high you're willing to go on the deductible. Most people, when getting a quote, are mainly concerned with the premium, but you need to also pay attention to the total out-of-pocket expense, including the premium, should you have to file a large claim. Never buy a pet insurance policy based solely on the premium. Let me say that again. Never buy a policy based solely on the premium. I've designed a policy selection Excel workbook that has each company's policies and all the different combinations of maximums, deductibles, and copays. And as you get a quote for each combination, the total out-of-pocket expense, including the premium, is automatically calculated. This is a good way to objectively see which combination of variables gives you a premium you can afford, as well as the impact it has on your total out-of-pocket expense. So let's look at some factors that affect the premium you pay for pet insurance. Where you live will affect how much your premiums will be. This is a quote on a 2-year-old golden retriever in 6 different cities. As you'd expect, the premiums in New York City and San Diego are higher than small town Texas or Alabama. The age and breed of your pet will affect the premiums. I got a quote on these different breeds of dogs and a couple of cats at 5 months old, 2 years old, and 5 years old, in Greensboro, North Carolina. Notice that the cat premiums are significantly less than the dog premiums, and a purebred cat has higher premiums than the mixed breed cat. Notice that mixed breed dogs have lower premiums than purebred dogs. Also notice the difference in premiums according to the breed of the dog. The Great Dane and the Cocker Spaniel are two breeds that have higher premiums. And I was really amazed at the Great Dane, how much more it was. As I mentioned earlier, the annual maximum, deductible, and copay you choose also affects the premium. And this is a quote from Pet Plan on a 5-month-old golden retriever in Greensboro, North Carolina. And we're assuming an invoice or claim amount of $15,000. And here again, when you're comparing policies, it's always important to choose a higher claim amount, because that tends to magnify any deficiencies that any of the policies may have. So let's look at this chart, and which policy has the lowest premium? It's this policy here, but notice it also has the highest out-of-pocket expense. Can anybody spot why? It's because it has a $10,000 annual maximum. And in effect, this sort of acts like a per incident maximum. So it's very important to get the highest annual maximum that you possibly can. Notice that to get the highest annual maximum with the same deductible and copay only costs $40 a year more. Here's the annual premium on the $10,000 annual maximum, and here's the annual premium on the $22,000 annual maximum. The gold policy with the lowest out-of-pocket expense is the one in the last column. Can you spot the reason why? The main reason is the 0% copay. Now you see why you ought to try to get the lowest copay that you can afford. Notice that to get the 0% copay only cost $91 a year more, but it made a $2,900 difference in your out-of-pocket expense. Now, even though this policy has the lowest deductible of the gold policies, it has the highest out-of-pocket expense of all the gold policies. And here again, can you spot why? Number one, the copay is 20%, but look at the difference in the premium, dropping that deductible down to $50. So with Pet Plan, changing the deductible affects your premium more than changing the copay or the annual maximum. And you'll find as you get quotes that this differs from company to company. Some companies, changing the annual maximum makes the biggest difference in the premiums. Now, I need to qualify something here about Pet Plan. With Pet Plan, if you take your pet to an emergency or specialty hospital for a non-emergency problem, your copay will be 20% regardless of what your policy's normal copay is. So you would be looking at this out-of-pocket expense rather than this out-of-pocket expense if this was done at a specialty hospital or an emergency hospital. It's just something that you want to look at when you're comparing Pet Plan's policies with those of other companies. If your regular veterinarian treats your pet, or the problem is indeed a life-threatening emergency, your regular copay would apply. Now, I put this slide in just to show you not only how these variables affect the premium, but more importantly, how they can also affect your out-of-pocket expenses. Every year, you'll receive a policy renewal about a month before your renewal date, and it will let you know what your premium will be for the upcoming year, and also if there are any changes in the policy. Your premiums will go up over time. It may be because your pet is older, although not all companies raise premiums because your pet ages. A common reason is inflation of veterinary medical cost, and this might be due to fees being raised, or as specialization increases, more services being done by specialists whose fees tend to be higher. Another reason is that new procedures or medications come out that cost more than the old methods and medications that used to be used to treat certain problems. Sometimes when a company changes underwriters, your premium may go up, or a company may increase premiums to be more in line with their accumulated actuarial data. But regardless of the reason your premiums go up, some pet owners may be tempted to just drop the insurance. But if you have one of the customizable policies, you can make adjustments to your policy to lower your premium. And just remember the priorities that I mentioned earlier. Also, if you have other optional coverages like wellness care or a breeding rider, ask yourself if you've really benefited from having those coverages. If not, consider dropping those. I used to do this every few years with my own health insurance. I think I started out with like a $250 deductible, and as my premiums increased, I kept raising the deductible so I could afford to keep the health insurance. I had to do some figuring on what my maximum out-of-pocket expense would be, including the new premium, with each deductible to see if it made sense. But you need to remember that anytime you make changes to your policy, ask the insurance company if it will affect coverage for any conditions your pet was previously diagnosed with. It is my understanding that downgrading a policy won't usually affect this, but upgrading a policy might. So just be sure and check with the insurance company before you make those changes. When you get a quote, each company will usually list their discounts that you might qualify. And some examples might be multi-pet discounts, military discounts, microchip pets, pets that are spayed or neutered. Is one company, if you belong to a certain club like Sam's or Costco, you get a discount. Or if you have a service pet, some companies offer a discount. But this is going to vary from company to company. But again, when you get a quote, on that quote page, when you put your zip code in, it'll usually list the discounts that you're eligible for. What about insuring multiple pets? It can be almost cost prohibitive depending on the number of pets you have that you want to insure. And here are several options. As I mentioned earlier, most companies offer a 5 to 10% discount if you insure more than one pet. Pet First has a family plan where you can insure up to 3 pets on the same policy. This is one of their standard plans, and all 3 pets would share the maximums of the policy. If you had 5 pets, you'd have to put 3 on one policy and 2 on the other policy. It's just something to check into and compare with multi-pet discounts offered by other companies. And be sure to not only compare the premium, but also look at the coverages of the policies too. And then if the company has customizable policies, you can choose a more catastrophic coverage. It might be possible to still get that worst case scenario covered, but have to pay more out of pocket because of selecting a higher copay or deductible to get the premium down. And here again, you want to start with that deductible and change that first, and the copay second, and lastly, that annual maximum. I recommend that you get a quote for your pet from all the pet insurance companies in the United States. That way you know you've considered every option. Apparently, a lot of pet owners visit pet insurance company websites and never get a quote. By getting a quote, you'll find out if that company will insure your pet before spending much time on their website. I've also found that you'll often find out information by going through the quote process that you won't find anywhere else on their website. Next, go to the best review website and read some reviews. And you need to concentrate on those written in the last year or two. The reason for that, again, is these companies change their policies from time to time, and some of the older reviews may have dealt with their old policies and not their new policies. I have a link to a video in the ebook where Mike Hemstreet, the owner of PetInsuranceReview.com, gives some tips on getting the most out of your visit to his site. And there's also a podcast episode that I interviewed him. Never purchase pet insurance without reading reviews. Read a sample policy. No exceptions. Do not, and I repeat, do not purchase pet insurance without reading a sample policy. If you read reviews, you'll run into this all the time, is that somebody is complaining about something that's in black and white in their policy that it wasn't covered. So, and one thing you'll find out is you'll find things out in the sample policy you won't find anywhere else. And then once you sign up for pet insurance and receive your policy in the mail, read it again and make sure it is indeed what you thought you bought. Most companies have a 30-day money-back guarantee as long as you don't file a claim. And so if you're like a lot of people, and this is not just pet insurance, but, I've done this with car insurance or homeowners insurance or whatever. You get that policy in the mail, and it's about 25 pages long, and it's in language hard to understand. And what do? You go and you just stick it in a file drawer somewhere and don't read it. But fortunately, pet insurance policies are relatively short. Most of them are 8 to 12 pages long, and they're written in pretty easy to understand language. And then if you have additional questions, call or email the company to get clarification. This will also give you a chance to sort of test their customer service. And then finally, choose a company and policy to insure your pet. I actually recommend that you choose the company first, and then double check your premium versus out-of-pocket figures to make sure you're getting the best policy that company offers to insure your pet. This is a table that's on page 12 of the ebook, and you can see that it has the steps that I recommend to do your research, and it contains all the links you'll need to carry out your research. These are all hyperlinks to each company's website to get a quote, and then these are links to the review page of each company's reviews on PetInsuranceReview.com, and then this is a link where you can download and read a sample policy, and then the contact information for each company. Now, what you'll find out, and I've found this out from readers of the blog that have given me feedback, is what you'll find out is that as you get a quote, you'll probably eliminate a couple of companies. And then as you go to the next step and you read some reviews, you'll probably eliminate 2 or 3 more companies. And then as you read a sample policy on the companies that you haven't eliminated, you'll eliminate 2 or 3 more companies, so that by that time you're down to just 2 or 3 companies that you can then call and get more information about. I wanted to mention the pet insurance toolkit I put together. It has the ebook, and it also has a pet insurance company profile PDF book in it. And this is it has all the companies that insure pets in the United States. It has a link to their website. It also has multiple hyperlinks in my review of each company that you can click on and go to specific pages on the company's website to get more information. And then there's an Excel company comparison worksheet. This is an all-in-one worksheet that has all the links on it that you'll need to complete the research that I went over. And the good thing about this is that it does those automatic calculations for you when you enter the premium, and then you enter the specifics on the maximums and deductibles and copay of the policy that you selected. It'll automatically calculate the out-of-pocket expense for you. And when you choose, there's actually drop-down boxes on there, and when you choose the policy, any restricted coverages will change according to the policy that you selected. And when you go to a pet insurance company's website to get a quote, you want to have in mind a premium that you're going to feel comfortable paying. There's so many variables from one company to the next, with maximums and copays and deductibles, and some of them are per incident, some of them are annual, and so forth, that it can get very confusing trying to compare 11 or 12 companies with one another. But the one variable that you can control is the premium. And I used to recommend, like, getting selecting a policy to put on the worksheets that the premium was between $30 and $45 for each company. And actually, that's a premium range that surveys have shown that most pet owners are comfortable with. So again, when you go to a company's website, you want to have in mind a premium, and then select a premium that that company offers to either print out. You can print it out and save it so you can compare companies, or if you're using one of these worksheets, you can enter that information on the worksheet, and then when you get through, you can compare all those companies side by side. And then I mentioned earlier the Excel policy selection worksheet that has all the companies and all the possible combinations of deductibles and copays and so forth on it, that you can actually find which policy that company offers, gives you not only the premium you're comfortable with, but also can give you the lowest out-of-pocket expense. Well, thank you for allowing me to share about pet insurance with you, and this is a link to my blog. And Harlan, do we have time for questions?
We've got lots of questions. We'll give you a couple. Some of our people, by the way, are typing in their guesses onto the question that I'm going
Well,
to ask.
good.
So here are some of the questions that we've gotten. I think you answered this, but are there discounts or group programs for those of us who have multiple pets? I have 9 dogs, and no way can I afford individual pet insurance 9 times.
Yeah, I think going back to that slide, the three things that you can do, and I sympathize for clients with that many pets, because I mean, even doing those things, it may be still cost prohibitive. Um, but fortunately, most of the pet insurance companies now have those flexible, customizable policies, and you may just have to play around with each of those variables and see if you can find a policy, for each pet. And if you've got that many pets, they're probably all different ages, and you may find out that some companies don't insure pets over a certain age, and so that may eliminate some of those companies. But um, I think the easiest thing there, you can try the pet plan, looking at that standard policy. That's kind of interesting. They're the only company that has that sort of setup where you can, 3 of your pets can share a policy, but otherwise, you're going to be left with just trying to um, get the most important things covered, and then manipulate those variables to try to get a premium you can afford.
Okay. Um, can you get dental coverage as well? My baby's young and has beautiful teeth, but dental health is very important to their safety.
Yes, just about all the companies cover treatment of teeth that are like broken during an accident. Um, Most of the dental cleanings, those type of things, would be covered under a wellness rider if the company offers wellness care. There are some companies that will cover uh, what we call periodontal disease, which is actually the most common disease that dogs and cats get. And but here's the qualification usually to have that covered. Those companies that will cover that, if you read their policy, they say something like, if your veterinarian recommends brushing your dog's teeth, or if your veterinarian recommended a dental prophy and you did not get that done, you didn't do what your veterinarian recommended as a preventative to periodontal disease, then even though they normally cover it, they may not cover it. So it's very important to follow your veterinarian's recommendations as far as preventing periodontal disease.
Okay, let's get another question here. Got lots of them. I don't have any pet insurance on my Jack Russell. He's 4 years old. Is it too late?
No, absolutely not. Again, if you insure a pet that's a little bit older, Uh, you probably know when you apply for pet insurance if that pet has any pre-existing conditions, if he's been treated for anything in the past, particularly anything of significance. But always, when you're insuring or applying for insurance for an older pet, as soon as you sign up for the policy, get that medical record review done. That's very, very important, and that'll put you at ease a little bit, knowing if there's any pre-existing conditions. It just gives you some peace of mind, because the last thing you want to do, and if you read reviews, this has happened. If you buy insurance and then you pay premiums for months or sometimes even years, and then you file that big claim, and then the company denies the claim because it's a pre-existing condition. because of something in the past. Because most companies will sooner or later request a copy of your pet's medical records anyway, unless it's the situation of like a puppy or kitten where there shouldn't be any pre-existing conditions if that examination, that first examination was, a healthy pet. So always get a medical record review done.
All right. I'm going to take back the screen. And here we go, showing my screen. All right. Well, thanks so much for being with us and answering those questions. Lots and lots of questions. We got to as many as we could get to. So now we're going to see who's going to answer the question correctly. Now we have somebody who has been typing in questions the entire time, and fortunately we haven't got there yet. What is the thing that you should ask for when you buy insurance? What is the thing that you should ask for? And we're not seeing an answer. We're not seeing the correct answer. So I'll repeat the question. What is it that you should ask for when you buy insurance? Oh, Brooke, what do we do? No one won. No one won. Joan did it. Joan got it. And the answer was a medical review. Joan, you did it. You're the winner. Please send us an email to info@thedogingtonpost.com. info@dogingtonpost.com. You are our winner. Joan has won a free voucher for a 25-pound bag of Merrick's new grain-free real Texas beef dry dog food. And in Joan's honor, Merrick is donating a bag to National Mill Dog Rescue. Congratulations, Joan, and thank you, Doc, for being with us. We will be with you another time this week. Tomorrow, you guys are going to be dog experts, and we will see you tomorrow evening. Looking forward to it. Everybody, the replay of this will be available just as soon as possible. Thank you, Brooke. Thank you, Brandy. Thank you, Doc, for being with us. Thank all of you for joining us. Have a great evening. Bye-bye.
Thank you.